So this morning I'm going to talk a little bit about a book that was recently published. It's almost today a year old. It came out for Parkinson Awareness Month last year. It's been a bit of a surprise for me because I've written hundreds of research articles, none of which are read by anyone. But it turns out that this book seems to be read by everyone. And it's sat on the top of the Amazon category as #1 for a year, which I thank you very much for, but I'm very inspired by that, and it's humbling in some sense, and I think it's important to know that there is a message here, and part of that message is that you can live a hopeful and happy life with Parkinson, and you don't have to have a bus or a truck full of snake oil and all sorts of things that people will offer you along that road. There are things that you can do today that will make a big difference for tomorrow and for each day and each hour of your life. And I really enjoyed the talk this morning by our guest speaker from Tallahassee, because I think that the message of positivism is really important. It's somewhat lacking in the field of Parkinson, and there's no reason for us not to be positive as we're following patients forward. We have PD20s, people that live 20 years with Parkinson, PD30s, PD40s, PD50s now, and so we need to understand this better and to help you to lead a better disease. Now, I invite you next door is a really nice presentation going on by Christopher Hess, who was brought here from Columbia University last year, and he's a new member of the Center for Movement Disorders. He's a neurologist who spent 3 years at one of the finest institutions in the country with Stanley Fawn in New York, and he is now the head and chief at the VA hospital and establishing a VA program for movement disorder patients, but also sees patients at our center who are not veterans as well once a week, and so we welcome him here. And I remind you that this, most of this talk, actually a longer version of it, is archived up on the National Parkinson Foundation website. Not that you would want to spend the rest of your beautiful weekend watching that, especially with the Gators playing in the Final Four. But in case you're not a basketball fan, it is up there, and it's I think is somewhat useful. So I want to just give a shout out to everybody on our campus. We have 45 faculty members that come from 10 different colleges across the campus. It's a 2,000-acre campus. As most of you know, it's one of the largest land-based campuses in the United States. It was established by a signature by Abraham Lincoln many years ago. And we are very humbled and very fortunate to have so many people from so many different colleges and areas that come together in one place and create this one-stop, very efficient, and also, I think, very exemplary model of care for Parkinson. And that's the type of care that we believe that Parkinson disease patients should get. So what are the secrets to living with Parkinson's disease? And I think many people always, ask me over the last 12 months, so okay, so what's the trick? What's the one thing I need to be doing? And it turns out that we've seen thousands of patients. There are over 7,000 patients now followed by Chuck Jacobson, who's taking pictures back there and logging all the talks this morning for the website. One of his jobs is to run the laboratory, and we have followed thousands of patients, and we know a lot about you. We have FBI profiles on you. We know where you live. We know when you shave. We know when you are lying. So it's been humbling, but you've also taught us a lot about the disease, and it's somewhat shocking to us, even in a center like this, when we have you come in to be seen at the clinic, and there are these things that you could be doing that make a big difference in Parkinson patients' lives that you're not doing. So you've taught us those things. We've tried to relay them back, and the book is really about those things. It's not about snake oil. It's not about there's going to be a cure tomorrow. We're all interested in cures, but we need to be living better with the disease. And so the goal is really to live a happier life. And this is a quote from Muhammad Ali, and he says the book's a critical resource for Parkinson patients and families around the world who speak different languages but suffer from very similar and often disabling symptoms. And I think it's a really important quote. It gets at the heart of the issue that no matter where you go in the world, from I've lectured all over, from Sioux Falls, South Dakota, to Beijing, to small areas of Korea, and when you talk to people with Parkinson, we look somewhat similar. They, no two patients look exactly alike, but their disease is basically the same across all continents, but we're not getting the word out. We're not getting the word out into different languages, and we're not addressing the global audience. And so one of the issues with the book was to address this global phenomenon. And you just heard a wonderful talk by Dr. Hack, who's a fellow who's going to be heading into the United States Navy, so he'll be taking care of families all over the globe that have Parkinson's and related disorders. And we've had over 30 such fellows, and he and his wife helped to translate the book into Bengali. And there's translations have been put into over 20 languages, and it turns out if you look across the world, there's not access to information that's in the right languages and is culturally appropriate to the audiences that are reading it. For example, they told me, Shankar Kulkarni, who's the therapist for many of you in this room, told me in translating it into Hindi, Dr. Okun, your little stories, they're really nice stories in English, but they're going to make people stop reading the book in Hindi. So, there are things that you have to understand that fit one culture, but don't fit another. So there are a lot of people suffering with Parkinson's. This is just a little graph, a little pie chart reminding us that from the year 2005 to 2030, we're going to grow in cases from 4 million to almost 9 million. So that's more than a doubling. This is only people over the age of 50. This is only the world's 8 most populous countries. If you're watching the news recently, you'll know from just the search that's out there for the Malaysian Airlines flight, there's more than 8 countries in the world. In fact, there are hundreds of countries in the world, and there are lots of people who have Parkinson who are below the age of 50. And so there's a tremendous need, and it's growing, and it's outgrowing our capacity to take care of the patients and to take care of the issues that are going to be facing the population as it ages. Now, the 4 simple words, "You have Parkinson's disease," are going to pierce the heart and drain the dreams of at least 50,000 people worldwide each year. That's probably about half the total number. That's the estimated number. It's probably closer to 100,000 or maybe more. And so when we see this sentence and we see these 4 words, we have to understand that this is something that if we make people live long enough, they're going to get Parkinson's disease. Age is the #1 risk factor for Parkinson's disease, and as we age, we're going to lose more cells in the brain, and we're going to have to say these words to more people, and we need to be very aware of what these words mean and the implications to people's lives. And I think this quote by Wu Zhong, who is a Chinese philosopher, really is very nice to think about, especially when we enter on the trail of Parkinson's. And Wu Zhong says that hope cannot be said to exist, nor can it be said not to exist. It's just like roads across the earth. For actually, the earth had no roads to begin with. But when many men and women pass, a road is made. And I think when you think about journeys, in particular the Parkinson journey, we're getting on a road, and we're making the road. And it's you and I and everybody else that's going to get on the road with the sufferers to try to move forward and try to plan and develop the hope and develop the future for the disease. And I personally believe there's a lot of hope. And patients will plant the seeds of faith. The ones that I have met, they have taught me that they learn to grow hope, and that you can discover the core values that are necessary to achieve happiness despite having a chronic disease. And so I think it's very important to remember that, particularly with Parkinson's disease, you can get to happiness, and there is a road, and there's a road that many of us are going to travel with you. So you say, well, that's, enough of this, this gibberish that's coming out of this guy's mouth. What are these secrets that you're talking about? I'm ready to hear what are the secrets, what are the things that we need to know about. And so I'll share with you what I think should be some things that are not secrets about Parkinson, but are important to keep in mind as you go along the journey. This is a quote from Julian Lauren from the novel Pretty, and she says, "I look for a sign. You never know where to go next. You never know when you'll get one. Even the most faithless among us are waiting to be proven wrong." So the signs of Parkinson's disease are really important to appreciate and to understand what is Parkinson and what is not. And I borrow this slide from our colleagues in Alzheimer's disease, and for those of you that can't see this garish purple sign, it says, "This way to a world without Alzheimer's disease with an error." And I often think to myself, that's the way to Parkinson's disease, because if you ask people when they're diagnosed, when they hear those 4 words, "you have Parkinson's disease," what that means, most people will tell you that's a very crushing and traumatic moment in their lives. They return home and they equate the diagnosis to having been told they have Alzheimer's disease, or to ALS, Lou Gehrig's disease, or to having a brain tumor or a very bad stroke. And so it turns out that Parkinson is none of those things, and many people are jealous of Parkinson's disease as a neurodegenerative condition because we have so many good therapies for it, both medical, surgical, and behavioral therapies. And so there's a road forward, and this is a chronic disease, like prostate cancer. It's something that can be managed. And I often tell patients, what you really need is not me. What you really need is a good general practitioner or geriatrician, because we're going to keep you going for a long time. You're going to end up with problems with your heart, or your prostate, or your lungs, or something else. And so knowing the science and understanding what you have and what you don't have, I think, is a really important fundamental principle in the disease. The next thing is I think, encapsulated by a quote by Jonathan Harris, who says, "The right thing at the wrong time is the wrong thing." So the right thing at the wrong time is the wrong thing. And everybody with Parkinson's disease knows that it's so critical that as you travel this path, as you're on this road, that you understand that it's not so much about the red pill, the purple pill, the fuchsia pill. It's not so much about what you have, all the new things that are going on, and that there's going to be something magical that happens. It's much more important that you and your doctors and your care team and the professionals around you, that you all understand that this is a dynamic disease, it changes over time, and that the keys to success really lie in the timing. Timing is critical. When you're taking medications and making sure that you've got the medications on time, every time, and that you're paying attention to the individual symptoms as they crop up. And as you get that challenge, you're jumping that challenge, and you're not depending on the newest, coloring pill to get you out of trouble. In many cases, people are loading you up with pills, but they're not actually listening to your symptoms and giving the pills at the correct time and in the correct combinations. And so timing is critical. I think it's a secret that many people don't appreciate in Parkinson's disease, and one that I always bring to light in patient visits. Here's a favorite quote of mine. It's a little bit moribund, so hold your ears if you don't like this kind of stuff, but I think it's a little bit funny as well. Jared Kent says, "I have a favorite cemetery. I go to it because it's really clean and the doctors and the nurses are all very nice." I have a favorite cemetery I go to because it's really clean and the doctors and nurses are all very nice. There's some wisdom, I think, in this quote, and if you look around and you scour along the internet, you'll see that some people check into hospitals and they don't check out. And in Parkinson's disease, this is a big problem, and we can actually hurt you in the hospitals because people don't know what to do and how to handle along this trajectory. This is a cartoon that I found about it, and And the cartoonist says some funny things. It says, you know, how to survive a hospitalization: set daily goals, wear slippers and wash your hands often, do what they say but not blindly, enjoy the perks, have a personal advocate. I think that's a really good one. Here's the most important one: get the nurses food. Bribe the nurses. And get out as soon as you can, in parentheses, safely. And so, you know, we laugh about this a bit, but it turns out that in the hospital, we've done projects on this with National Parkinson and throughout the network, that 3 in 4 people that go to the hospital with Parkinson's disease don't get their medications on time. And so that's a really big problem. We also know in surveying the centers there's all sorts of problems with aspiration, pneumonia, infections, giving the wrong medications, giving meds that block dopamine, etc. So we have these free kits now that are available that have been the product of all of this research. So, you know, we generate all this research and we spend all these federal dollars, thus maybe once we come up with something practical that might help people. We've given out about 30,000 of these. They're free. I mean, others can get you some from our clinic as well. This is the packet that you can take to the hospital that could save your life. It has a form in it that you can give to your doctors and your nurses. It has all sorts of information, and it allows you to become an advocate and you to educate the people taking care of you, because they don't know Parkinson's disease, and so they need a little bit of help. And until we get better protocols that are adopted across the United States, you're going to be the ones that are going to provide the help. And when you do that, that's going to help the next person in the hospital, because the nurses and the docs are going to go, oh, don't do that, don't give them that medication. They have Parkinson's disease, and I know all about this. And so it's a pay-forward sort of thing. I think of these kits as like the bag that you pack. If you have children, you know, when you're expecting your first or second or third or more child, you pack a bag and you got to be ready to go to the hospital, and your mind is sort of crazy, you know, at that time when you're headed to the hospital. It's the same thing with Parkinson's. It's nice to have a little bag pack that you can grab and take with you, and it will keep you out of trouble and hopefully allow you to check out. 1 in 3 patients, research studies have shown, this is one from National Parkinson, 1 in 3 patients with Parkinson's disease per year, that's your chance of attending either an emergency room or a hospitalization. So it's a 30% hospitalization risk. May not be related to your Parkinson, but, you know, gosh, if they don't understand your Parkinson, you could be in trouble. So the next secret is about lack of activity, and this is, I think, best articulated thousands of years ago by Plato, who says that lack of activity destroys the good condition of every human being, and while movement and methodological physical exercise can save and preserve it. And I think you've heard a little bit about this this morning in the talks, but lest you should know that in Parkinson's disease, exercise is like a drug. When you exercise, it actually sports these things called neurotrophic factors. They're like miracle growth for the brain. They help your brain to function better and allow you to actually enjoy a better symptomatic existence, both in the motor symptoms, but also in the non-motor symptoms like depression and anxiety. And so we always say exercise every day. Remember that many research trials are drilling holes in people's brains to inject neurotrophic factors. Well, guess what? If you exercise, you don't need a hole maybe drilled in your brain. You can deliver those trophic factors in a very natural way. And so we now know that this is not voodoo, this is not snake oil. There's something to it, and there's lots of literature to support this approach. Another secret that's really important to remember is being aggressive in treating depression and anxiety and Parkinson's disease. They are core features of the disease. It's not just that you are depressed or anxious because you have Parkinson's. And Elizabeth Gilbert says, and a couple of pieces of, I think, a quote from one of her books that I like is, you know, she talks about wandering off the path and finding your way back to the trailhead. And when you're depressed, you often get off that path and you think that any moment you're going to get back on it, but it's not quite so easy when you get into these states of depression. And when, you know, it gets to a point that you may have to admit that you're bewildered so far off the path that you don't know from which direction you came or from where the sun rises anymore. And this happens to Parkinson's patients, and it's very common. It happens in more than half of patients who have Parkinson, and we need to accept it as a core feature because it's very treatable and affects quality of life. And in fact, across studies, if we ask the question, what affects quality of life more, motor symptoms, tremor, stiffness, slowness, walking, or non-motor symptoms, depression, anxiety, sleep dysfunction, what affects quality of life more? I've led you down the path to sunlight. Very good. Non-motor symptoms affect quality of life more. And in the largest prospective study, this was published in a very important medical journal called the USA Today, who picked up on this study of the National Parkinson Foundation, and they essentially, the first major finding from the largest prospective study following Parkinson patients, one page of data once every year, 5,000 patients enrolled, is that depression is the biggest unmet hurdle in Parkinson's disease. And so we need to be aggressive in treating, identifying and treating depression, depressive symptoms, and mood disorders. Another secret that I think is important to remember is something that actually Nathaniel Hawthorne wrote about. He said, "Is it a fact, or have I dreamt it, that by means of electricity, the world of matter has become a great nerve, vibrating thousands of miles in a breathless point of time?" And it turns out that it sounds a little bit crazy, but in about 1 in 5 or more patients with Parkinson's, sometimes you can have your brain be electrified, and you can become bionic, and this can help your symptoms. And it's not a therapy that's for everyone, but certainly applying electricity, we now know, is not totally crazy, and that there are reasons to do this. This is a recent TED Talk that Dr. Foote and I gave, and we've done about almost 1,000 of these operations for all sorts of things, from Parkinson's to Tourette to obsessive-compulsive disorder. And the thesis of the talk is that your brain controls everything. It's what makes you who you are, controls your emotions. There are trillions of cells and connective tissue, and then we can control your brain, and that should make you very uncomfortable. But this is true of many therapies, and as we develop new therapies and technologies, we have to remember this, and we have to have an underlying ethical principle, which is to do no harm and to do it for alleviating human suffering. And so when we think about Parkinson's disease in particular, we always see these miraculous videos of before and after, and you can see on your left before and on your right after, and now everybody's going to say, okay, let's sign up, let's go do this, let's do this thing. But the list on the left are things that respond really well to surgery, like tremors and dyskinesias and medication fluctuations, and symptoms that respond to the medication. But on the right, we still have a ways to go. So we're developing things in our laboratory, and others are developing things to address gait, walking, freezing, balance, speech, cognition. Sound familiar? These are unmet needs in Parkinson's disease. And so knowing when to make your brain electric and talking to your doctor about it, I think is very important. So I want to finally talk about one last thing that I think shouldn't be a secret, and this is, I think, best articulated by Sir Arthur Conan Doyle, who said, "There's no need for fiction in medicine," remarks Foster, "for the facts will always beat anything that you fancy." And I always remind people with Parkinson's disease to ask your doctors and bug them at every visit about what's new, what's going on, what should I be thinking about. We have lots of things that are going on in the field. We have a free Ask the Doctor website up at National Parkinson Foundation. We answer the questions personally. We've answered over 20,000 questions from every continent except for Antarctica. We have a What's Hot in Parkinson's Disease blog on the National Parkinson website, and we also have a blog on Parkinson treatment tips on the University of Florida website. So ask for the evidence, ask what's new, and always bug your docs. I am an experienced speaker at PD Symposium around the world, and I know that before you get off stage, if you are going to deliver the right message, you need to talk about what are some of the new research updates, and I was happy to hear Dr. Hack mention a few of these. I'm going to throw a few of them out here because that's one of the reasons that you came out to spend your day with us. So very briefly, things to watch for that are coming in the next few months. This is a drug called pimavanserin. This is a drug to address hallucinations and psychosis in Parkinson's. The reason that we care about it is because it doesn't block dopamine, it blocks serotonin. It has been given FDA approval and it is being packaged, and so it's another drug with a very new mechanism, and we think it's going to play a role for helping patients. There's a new pump therapy called the duodenal pump. It's available actually here at University of Florida through a trial run by Dr. Rodriguez, and the phase 3 study has actually been completed. It's been submitted to the FDA. We expect a review back within the next 60 days. This is continuous infusion through a gastric mechanism. Some of you in this room may have it. It's a great therapy. We think it's going to help a lot of people. Similarly, there's a nice shot therapy that some of you have gotten, the little subcutaneous shots like diabetics called apomorphine. There's a new pump to allow the apomorphine to be given continuously. This is moving into therapy in the United States, and so watch out for these two new pumps, duodopa and apomorphine. Dr. Hack related to you that this new drug called droxidopa has been given a name in the past month. It's called Northera, like the North Star, ERA. It's a drug that is approved on a special accelerated approval process by the FDA, meaning they're going to allow you to get it, even though all the studies haven't been completed, because they're so promising, which I think is promising news in general for the FDA to be thinking in this way. It's an amino acid that metabolizes into a chemical called norepinephrine, helps to keep your blood pressure up for people that are getting dizzy or having low blood pressure problems. There's an inhaler that's coming for Parkinson's disease, and so we might in the next 5 or 10 years see a lot of Parkinson's patients looking like chronic lung patients or asthma patients, and what if you could take a puff instead of take a pill? I think this is something that people are very interested in. It's just passing its safety testing and working its way onto the next phase, so keep an eye out for that. There's a drug called isradipine that lowers your blood pressure, but also maybe, and I stress maybe, protective for Parkinson's disease cells in the brain. It's a $23 million phase 3 study that was just announced in the last 2 weeks by the National Institutes of Health. There'll be 56 sites. We expect to be one of them here, and so you'll be hearing more about that study. We also have an ongoing study here called pioglitazone. This is a diabetes drug that is showing promise for potential Parkinson's disease progression and anti-inflammatory activity. And I think you'll also be hearing more about this as we approach getting results back on that one. Rapid fire, we have a new extended release Parkinson medication that was given FDA approval called IPS 066, also by the name Rytary, like the old Atari. That's how I remember it anyway. And it's now planned release in 2014, was FDA approved, but the plants that are manufacturing this drug ran into some problems were cited by the FDA, and they've got to fix the manufacturing plants before you'll see it hit the market, but it's an extended release formulation of dopamine. I remind people that more evidence is out showing that the glutathione injections that were thought to be promising for Parkinson's disease have been shown to not improve the symptoms or be protective in Parkinson's, and so if you're paying for shots of glutathione, you should take a look at that research. Watch out for stem cells and stem cell tourism. That's the newest thing. There are lots of statements coming out about this, including one from National Parkinson. If you are approached and asked to get $50,000 or $100,000 of your retirement to have a stem cell infusion, really think twice. Talk to your doctor about this. There are very few research protocols that are real, that are being monitored, that are safe. We all are excited about stem cells, but they still have a ways to go, and so be careful about any trips to Mexico, China, Germany, or other places, sometimes even in Los Angeles, Las Vegas, and believe it or not, the state of Florida. you again for allowing me to speak to you all, and also thank you for all of your great comments on the book, on the 10 Secrets book, and maybe you'll inspire us to write another one based on the other 150 secrets that we left out. So thank you very much, and I think we're going to transition into do an Ask the Doctor session.